At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live.
All right. Hello and welcome. I'm Jeff McIntyre. I'm the Vice President of Liver Health Programs at the Global Liver Institute, and I'm really excited to join everybody today for this episode of GLI Live. So next week is Global Fatty Liver Day, which is formerly, International NASH Day. And during this day, communities around the world raise awareness, increase education, and conduct screenings for the most common liver disease in the world, fatty liver disease. One of its most common risk factors is obesity, which for many reasons has really gotten a lot of attention lately. And I'm really, really delighted to be joined today to talk more about that connection and its kind of contributing factors with Dr. Kelly Brownell, the Robert L. Flowers Distinguished Professor Emeritus of Public Policy, Professor Emeritus of Psychology and Neuroscience, and Dean Emeritus, Sanford School of Public Policy at Duke University in Durham, North Carolina. That is a mouthful. Kelly, thank you for joining us today. Welcome.
Jeff, it's really nice to see you again. It's been a while since we've had the chance to connect, so I appreciate the opportunity, and thanks so much for all the amazing work you and your colleagues do.
Yeah, absolutely. It's really great to see you again as well. For folks tuning in, Kelly and I worked together in the past on issues around food marketing to children and childhood obesity. He is someone that I have learned a great deal with. I think we were on a council at advisory board at Robert Wood Johnson and back on during kind of the Let's Move days of the Obama administration. Your perspective and research has always been educational for me, and I think and feel like it makes such a great contribution to the field. And certainly I've kept up with you on your great podcast, The Leading Voices in Food. So in the spirit of making connections, our audience in the liver community might not be as familiar with you and your work. I'm wondering if you can kind of introduce yourself and talk about how you approach this topic of obesity and the work that you do.
Well, I started my career, more than 35 years ago, doing clinical trials for treatment of obesity. And the hope then was to test different treatments against each other and make progress over time so we could provide some help to the people who wish to lose weight. Several things about that made me take a whole different approach and I began to think of prevention rather than treatment. And the two things that happened, one is the results of treatments weren't very good back at that time. And then for many decades after that, they've continued to not be very good. There's some exceptions lately, but we can talk about. But that was the case back then. And then also, I got very interested in what happened to people who lost weight and regained it, because that was pretty typical of people in these trials or people on diets in general. People would lose weight by whatever means, but typically regain it. That was almost a universal response. And the question is, what does that do to people when they lose and regain repeatedly? And there was something in particular that got me interested in that when I was talking to a patient who was part of a clinical trial. And then we started to do some studies on what later became called weight cycling, or in a more colloquial term, we started calling yo-yo dieting. And what we found is that and we did some studies with lab animals that I'd never done before, but human trials, and also we started doing epidemiology studies to look at the health consequences of these repeated cycles. And basically what we found is that people who lost and regained found it harder to lose later and then regain more rapidly as these successive cycles occurred. So there was a metabolic shift that occurred because of these cycles, but then also there were quite negative health consequences too. So for that reason, it seemed to me to work on these weight loss approaches that weren't very effective and put people through these cycles didn't feel good to me. And so I thought this might be a problem that's better prevented rather than treated. You could think of lots of examples, but, lung cancer from cigarette smoking. Sure, you can try to treat it, and you want helpful things for people who have it, for sure. But the most effective public health response is to prevent it by stopping the cigarette smoking. And I wondered whether there weren't parallels. That led me right to policy and upstream causes and things like that.
It's fascinating because I feel like we live in a world now where yo-yo dieting, or at least rapid weight gain after weight gain after rapid weight loss, is just kind of built into what people experience. Whether we hear that with the trends or the substance around things like intermittent fasting. I know that's been one of the concerns about people going onto the GLP-1s as well. Have you seen associated chronic disease or conditions that are also relaxes a little bit, comes back? Where do chronic diseases fall into that?
Well, after I did that work on weight cycling, which now goes way back, I then turned my attention to prevention and policy and things like that. So my knowledge of that particular question is pretty out of date, because that was a long time ago I did those things. But from what I see in the literature, it still holds that these cycles of loss and gain aren't very helpful. And I still believe that prevention is an important thing to consider.
Well, that kind of is a nice segue that sets us up for part of the reason we're here today. I mean, that there's a really close link between fatty liver disease and obesity. I mean, to the extent that 50 to 90% of people with obesity also have fatty liver disease. And from the work that you've done, obviously moving into the policy arena, that can be very individualized. But in this instance, I want to ask about food systems specifically, and kind of where do systems fit into the rise here, and in disease, especially metabolic associated diseases such as diabetes, cardiovascular disease, fatty liver disease, et cetera, et cetera. I don't think patients always have a good grip on the interplay between food systems and where they've ended up dealing with the things they've had to end up dealing with.
I'm glad you used the word systems in that, because for a long time people were concerned mainly about particular foods, like you would have a diet that was too high in sugar or too high in fat, and then the dietary intervention was to change those things. And people might get upset with the food industry for pushing those foods really hard and things. But then when people began to think of food systems, they began to think of a broader set of drivers that were influencing the population diet. And that went way back to where the food's first grown. And so now people are thinking about what is the state of agriculture in the United States and other places around the world. How is the food produced? What are policies that influence the world of agriculture, and how does that affect diet? And so, one sort of simplistic, the economists say it's more complicated than this. But for example, going back to the Nixon administration, there were heavy subsidies given to the farmers for certain things that was meant to help make them more internationally competitive in the market, and they worked for that reason. But what happened is vast amounts of things like corn and soybeans began to be grown by American farmers. So if you look in the 1950s at what was grown in a state like Iowa, it was all kinds of different fruits, vegetables, lots of animals and things. And now it's mainly corn, soybeans, and hogs. And that's strictly due to the policy that got passed. Well, if you're producing vast amounts in corn and soybeans at very low cost because of the subsidies, then the industry needs to find something to do with those, and processed foods became a pretty good solution. And so the sort of things that are now just part of their background, like the trees and the clouds and the sky, are packaged snack foods and chips and all that kind of stuff. Well, those are all made possible because of processing advances from on part of the industry, but also the low cost of the products that go into those things. So that's part of the issue. And then, of course, there's the food industry that is in business to sell the maximum amount of food. And the way you do that is you make it highly palatable. You do things that make it very pleasing to the chemistry in the brain.
Right.
And you do all kinds of other things that maximize consumption of your products. And as long as you do that, then you do well on the profit side of things. And so that whole system is a whole bunch of players doing a whole bunch of different things. It's very complicated, but people are beginning to untangle the pieces and look at what might be done in order to create a healthier food system that does two things. It promotes human health, but also is safe for the environment.
Yeah, that's so interesting because we do definitely get into this aspect of demonizing specific foods, and when I think of that, I think specifically of, high fructose corn syrup, for instance, something that's ultra processed, high fructose corn syrup, where it takes the attention into the micro without realizing kind of the macro systems that are behind it, if you will, as you just eloquently kind of demonstrated as well. And it's been well documented that obesity and fatty liver disease have been on the rise, arguably since '70s, but we really saw that boom in the '80s come with the confluence of not just the regulations there, but also deregulation in the FCC and the Federal Trade Commission and food marketing, specifically with efforts to, kind of stymie this, mostly, fruitless, no pun intended. And we've seen that rise in food marketing to children. I talk about that quite a lot. When we talk about systems, I think that's the place where we really talk about disparities quite often, disparities of access to healthy foods. And I feel, frankly, you and I used to talk about concerns about processed foods, and the conversation now is about ultra processed foods that we have to go step on. What do you consider to be the major contributing factors in the rise in patients with obesity?
Well, there are a ton. First there's the food itself, which has changed a lot over the years. And there's a really interesting body of research on the issue of food and addiction, and whether consuming food triggers reward pathways in the brain, very much like classic substances of abuse.
Right.
And there are three colleagues and I are about to publish the second edition of a book on food and addiction that brings together all the available science, and it's very compelling. Compelling in that if you look at the neuroscience of the brain and you look at sort of basic biology overall, these foods, especially foods that are high in sugar and foods that are ultra processed, we can talk more about what that means in a minute, but the consumption of these foods is triggering these reward pathways in the brain that create things like craving, withdrawal, tolerance, and other things that keep people coming back for more. And of course, that's very much in the interest of industry. You want people coming back for more, so they're buying as much of your food as possible. But the question is that okay that they're doing that? And how should the public feel about it? And should the industry be held accountable for that kind of activity? And that gets complicated, but it's a very interesting question to at least ask. Now, you mentioned ultra-processed foods. That's a relatively new concept on the scene. The concept was developed by a very fine scientist in Brazil named Carlos Monteiro. And he's worked very hard on this, but a lot of others around the world have too. And now there are lots of studies on the impact of these ultra-processed foods. And the basic premise that began this work is that there may be something about these very highly processed foods that are triggering bad things in the body, aside from the nutrient composition of those foods, that something inherent in the processing is creating these, what some people would call frankenfoods, food the body just never was accustomed, you never encounter a Cheeto in nature or a Twinkie or Coca-Cola. I mean, it's just not out there.
Yeah.
So when these foods the body doesn't biologically recognize enter the body, what happens to them? And a colleague of mine and one of the top leaders in this issue of food and addiction, Ashley Gearhart, who's at the University of Michigan, she'd be a fantastic guest, by the way. I heard her once use the following analogy, that if you take the coca leaf in nature, people might chew it, get a little pleasure from it, but people can live in harmony with it and it doesn't create problems. But if you process it and it becomes cocaine, then it's different. And if you hyper process it or ultra process it and becomes crack cocaine, then you have a whole different thing. So nobody I've ever heard of abuses wheat or abuses corn. But when those things are turned into these highly processed foods that are part of our everyday life, then it's possible that all bets are off, and you create this metabolic and health havoc from it. And so more and more people are beginning to think that it's not only how much, sugar, fat, salt something has, how much protein it doesn't have, or fiber it doesn't have, but the process that it's used to make it becomes an important part of the picture.
It's so interesting because, the points that you pick on there of, taste, of the ability to perhaps play into this sort of addiction response that happens in our brain in reaction to certain foods. And if you combine that with, the market-driven incentive to have a longer shelf life, then you really are coming up with these sort of frankenfoods, if you will, that are really appealing, things I'm sure I've probably had in the past week, things that play to our emotional response. And if you add that to kind of the emotional cell of eating, if you will, they don't call them filling meals, they call them happy meals because they're selling you a little bag of happiness, not, that's what you want to be associated with.
So Jeff, before you move on, I can give you a little anecdote on exactly that point that you made.
Yeah.
So before I moved to Duke, I was on the faculty at Yale University for many years. When I was teaching classes both there and at Duke, I would show a slide of the ingredients from a food that people knew of, but I didn't tell them what that food was. And I asked them to guess what the food was from the list of ingredients. Well, this food had 56 ingredients on the list, and it turned out to be a Pop-Tart is what it was. And some people could kind of guess, most people couldn't. But the point was, when you have 56 different things that are in a single ingredient, how is ingredient 34, interacting with ingredient 49? And because you mentioned shelf life, so there are things in there to give these things almost infinite shelf life. They, there are preservatives and coloring, all these things that we know are in food, but we don't really know what they do. I mean, we might know that number 39 is okay because somebody did the toxicology on it way back when, but we don't know how it interacts with these other things, and that's part of the processing that seems to now be proven to have negative consequences.
Yeah, absolutely. I mean, it's a little bizarre to me that people are so suspicious these days. Perhaps, we've seen it accelerated during the COVID pandemic of clinical trials. And we do a lot of work around trying to dispel myths and suspicions and promoting clinical trials as healthcare, especially for those in disease states that may not have medication. But then when you look at what folks ingest and the testing they've gone through, it's often been mysterious. It's behind these corporate walls that don't allow for transparency, and with chemicals and words that most people can't pronounce, much less have any sort of public indication of what the interaction is. We're still getting people to understand that, iron and vitamin C are helpful together, much less, to chemicals that we can't pronounce.
I'm sorry if I interrupt too much, just, give me the time out. But you remind me of things. And, you mentioned that our paths had intersected earlier around the issue of food marketing. And I'm really happy that you're continuing to talk about that because it's really important. So, no matter how much education you or I might do or our organizations might do, it's completely overwhelmed by what the food industry can do. And so, something really needs to be done to rein that in. And the example I use to show how much of that there is, back when you and I were connecting, the Robert Wood Johnson Foundation was doing work on childhood obesity. They were an absolute godsend in this space. Yeah. Many people were working on it. And they had pledged to spend $100 million a year over a 5-year period. They ended up doing even more than that, but that's what they had pledged. So I sat down one day and I figured out in a given year, which day of the year the food industry had already spent $100 million just advertising.
I remember this. Yeah, I remember this.
And it turned out to be January 4th.
Yeah.
So by January 4th, the industry had already spent as much as that foundation was going to spend for an entire year. And that foundation was by far the biggest funder of work on that topic. Yeah. So you just see how overwhelming the odds are. So the industry can pretty much undo anything else that you or I do in no time at all.
So I want to pick the psychologist side of your brain for a moment on this, and kind of come out of the gestalt, out of the systems. And we know that obesity and fatty liver disease are often linked to and correlate to depression and other challenging disorders within the individual. And the links can be kind of cyclical and interrelated. Can behavioral health interventions, coaching, counseling, et cetera, play a role in the management and recovery of patients with these conditions? Throw us a lifeline, throw us some hope in here.
I think so. I do think there's an important role for that kind of work. The work on obesity and mental health issues goes back many years. And when people started to find a correlation between poor mental health and obesity, nobody understood cause and effect, because it could be that people with mental health issues might eat in response to those, and therefore it drove the obesity. Or it could be that the obesity was causing the mental health issues, which would not be hard at all to understand given how society responds to people with obesity. Mm-hmm. So that needed to get untangled. And then along came work on weight stigma, bias, and discrimination. And that really got driven by a donor, a philanthropist named Leslie Rudd, who funded the center that I had run at Yale called the Rudd Center for Food Policy and Obesity. That moved to the University of Connecticut, where it now is. And a person who was a graduate student of mine at the time, Rebecca Poole, agreed to take on this issue of weight stigma. And it was really a courageous thing that she did, because nobody was really studying it much. But she I give her credit with basically establishing a field. She just worked and worked and worked on this, was very passionate about it, still is, and just has the most amazing body of work now that she's been studying this. And she's found that weight stigma and weight discrimination ranks right up there with gender and racial discrimination in terms of its strength and tenacity. And she finds that it basically pervades, and she and others who have worked with her, find that it pervades every important area of life. Educational attainment, certainly the use of healthcare, your treatment in the healthcare system. It affects family relationships and things like that. So the fact that people are so severely stigmatized certainly influences their mental health. How could it not? Yeah. Just like it does with other, things like racial discrimination. And that in turn has health consequences. So it's probably the case that there's some portion of the health consequences of excess weight are coming from the fact that the condition is stigmatized. There's all the biology of it, but there's also this social and psychological part that's really important. And so what the last thing in the world we need is more stigma.
Right.
And so anybody who thinks that you can shame people into losing weight or, going on a diet or whatever it is, it's a silly assumption to begin with. And who would think that something that inhumane would be worthwhile? But it's actually been shown to be counterproductive. So that's why I've always looked at some of these things as people have a condition, and it would be, it would be nice if they didn't have to deal with that condition.
Right.
So anything that can be done to prevent it in the first place, anything that can be done to be helpful to people along the way is really important. But you certainly don't want to stigmatize the people who have it.
Well, and we see, such a, what I refer to as a stacking effect in liver disease, especially, where you often get people that are suffering from the stigmatization of obesity and overweight. And then you get the added stigmatization of liver disease, where folks are not understanding that, you can have a fatty liver, or you can have liver disease in some sort and not be an alcoholic. Or perhaps even worse, you're stigmatized because you have alcohol-related, liver disease as well. And so if you combine these sort of things, then it absolutely leads to the stuff that you're talking about the depression. It can lead to self-isolation. It can lead to all these other things, which we're beginning to see a good body of research on having kind of not independent, but correlated sort of physiological effects that are detrimental, also.
Yeah, and I totally agree with your premise that it's important those things be considered, not only in the medical environment, but in others as well, and that behavioral health services can be an important part of the picture.
So I think we'd be remiss today in this conversation without talking about this kind of rise in anti-obesity medications. We've seen them to be remarkably effective and are even under study for, alcohol-associated liver disease, for fatty liver disease. Not every technological development can be called a breakthrough, but this one might stand some test of time, if you will, and earn some designations at an important point. What changes and what doesn't change about the conversation around obesity on a systems level with the integration of these anti-obesity medications?
I agree with your instincts on this, that this really does represent a breakthrough. And it's been the holy grail of the pharmaceutical industry forever. I mean, imagine finding a drug that might be used by 2/3 of the population. You can only imagine. And the drugs haven't been out all that long, and they've really taken the world by storm. I mean, it's hard to go through a day without seeing some article about them in the news cycle. And the companies are making so much money. The first product came out from a Danish company called Novo Nordisk, and it's changed the basic economy of the country of Denmark. That so much, the company is making so much money. So they're really out there, and they're a presence, and I think are likely to be for a long time. And people are fine tuning them, making them even more effective and stuff. And the companies, of course, are spending lots of money on trials to try to get the newest, most effective drug. People went through years and years of frustration trying different drugs that didn't work very well. And people either couldn't tolerate them very well, or they didn't have good effects, and people went off of them and stuff like that. So here come these drugs that really do work. I mean, people lose an awful lot of weight on these. And if people stay on them for a long time, then that weight loss tends to be sustained. Now, and if they go off the drugs, the people tend to regain the weight, although there's still trials underway to find out how much they regain and whether they retain some of the lost weight and all that. And as I said before, losing weight and regaining it doesn't seem to be a good idea. So it's important to think of these drugs as things that you use chronically, like a blood pressure drug. If you go on a blood pressure drug and your blood pressure goes down and then you go off and it goes back up, that's evidence that the drug is effective. Not that it's ineffective, but in the weight loss context, people look at it differently and they say, "Oh, these drugs don't work because you go off of them and you regain it." It has to do with the stigmatizing part of obesity in a way. So I think these drugs are here to stay. They're absolutely life-saving for some people. Thankfully, there's help available, but no drugs are side effect free. And it could take many years to find out what the long-term effects of use of these drugs will be. And they're very expensive. And so you talked about equity issues before. This is certainly an area where that applies. So, people, unless you can get it covered by insurance, which is pretty spotty right now, then people are going to have to pay a lot of money to use these drugs, and that makes them inaccessible for a big part of the population. So it'll be interesting to see how this all sorts out. So to me, again, it's like if you come up with an effective treatment for lung cancer, hooray. I mean, people that have lung cancer, you want to give them the best help you can possibly get. And if you can save their lives, fantastic. But boy, wouldn't it be nice to prevent the problem in the first place so you don't have to go to treatments like this. And also what you don't want to do is then make it sound like, well, okay, all these things that are driving obesity in the first place, they're all fine. We don't have to worry about them now because we can treat them away with drugs. You certainly don't want that. You still got to try to change the environment and make it healthier for people.
Yeah, that is a concern, isn't it? That you've got the anti-obesity medications. So now eat all the things from ultra processed all the way down. So this so we've got this kind of pharmacological aspect going on right now with some potentially pretty potent tools to fight obesity and ultimately fatty liver disease and other conditions. former Mayor Bloomberg infamously started, the soda tax in New York City. I think you and I were working together when we did that. Mexico's got some really interesting sort of front of label designations for their sodas and foods. I saw some recent news about that as well. Is it me when I kind of feel like these can be Band-Aids without addressing the systemic issues, especially around disparities? Or do you consider them like necessary but not sufficient? What are the policy levers that our national and international leaders should be applying to kind of help move the needle here?
Well, anything that exists now could be considered a Band-Aid because there aren't enough of these policies put into place in a systematic enough way to really make a difference. Wow. So, there's no single thing you could do to help address the obesity issue. You can do things that are a good step forward, and in conjunction with other things, ultimately it might work. Very much like with tobacco.
Right.
With tobacco, there were taxes, there was education, there were clean air laws and banning smoking in public places. There were a whole series of things, and it was only the combination of those things that really created the profound drop in smoking rates. And the same thing needs to happen in the food space, but it's just not. You get these selective victories here and there, but you need a lot more. Some of them will probably be better at addressing equity issues than others. So one of the issues I've been working on for many years are soda taxes. And they came right out of the tobacco playbook, where the high taxes on cigarettes were the strongest single driver of the decline in smoking rates in the last century. And so why not think about that in the food arena too? Now, it gets more complicated with food because with tobacco, there's basically a single product. There's the cigarette, and you can tax that. But with food, there's lots of different foods. So you've got to start with some category like sugared beverages. And that's where the science was very strong, linking that to negative health consequences. So some of this, those taxes exist in more than 50 countries around the world and in some cities in the US. And so scientists have studied them and their impacts in various locations. And the work that I've seen suggests so far that they help with equity issues, where if you drive up the cost of the product and people shift to a healthier beverage like water, the people who would, which tends to be the substitution people make, the people who would benefit the most are the ones with the most serious health consequences and the least access to medical care. So they would benefit from it. And it's especially the case that there's the potential for benefit depending on how the revenue gets used from the tax. And Berkeley, for example, which is one of the cities in the US to pass the tax, has a council of community members and scientists and things that decide how that revenue is going to get used with a very specific agenda to address equity issues. So that's the case where you might get benefit from the consumption pattern change that are produced by the tax, but also wise use of the revenues. But you have to do that along with restricting marketing, so there's not as much of that. The changes in labeling practices, the industry formulated its foods differently so they're not triggering addictive processes. You have to do a lot at the same time, but there's not yet the political will to do all those things at the same time. The closest that's occurred is in the country of Chile, where they've done a suite of things that are really pretty impressive. In some countries, the industry is incredibly politically powerful. The US is one of those. In others, a little less so they're able to get more things done. So we'll have to see ultimately how that plays out in the US.
I feel like, Kelly, you and I could easily go into one of those 3.5-hour podcasts and still have stuff left over to talk about. But I want to be respectful of your time and of everything going on. So I want to close out this conversation by giving you a chance to leave liver patients with a parting thought. So, whether that's a paradigm shift about how to think and talk about food systems, or about obesity and chronic disease, or about, maybe the solutions that hold the most promise. At the end of this conversation, what would you like to see the community of liver patients and liver health advocates know best?
I'll leave on an optimistic note. As I've been teaching classes with young college age people over the years, there's been this very steady increase in interest in food systems and what to do to make them better, both for environmental and health reasons. And that has led to a level of activism among people that I think is very helpful. So, people are saying, we can't continue to have so much meat consumption because it's bad for health and bad for the environment. So what can we do about it? So they start talking to legislators, they talk to their contacts in the media, they talk to friends, they talk to family, and you have these conversations over and over. It's a signal of social change, but also a driver of it. So I'd say every person listening to this podcast can be an active voice in those conversations, talking about healthier food systems and paying attention to where food comes from and what impact it has on the environment. And for the parents, they can work with their school systems through the PTA and things like that about having healthier foods for their children. For people that like to write letters to people in the legislature, write them, let them know that you want a healthier food system and that you care about it and things. And people in church groups and social groups and just within their families can make a big difference by caring about these things and talking about them. And so I'm really excited about potential for the future because of this increased interest that I see. And a lot of people know more about this than they ever have.
Super fascinating stuff, Kelly. Thank you so much for joining us. Before we head out, I want to make sure you mentioned you have a book coming out and certainly the podcast, which I'm familiar with. But when people are looking for these things, where do they go? How do they find you for this stuff?
Well, the book is a book for hardcore science people that would most everybody else would find it pretty boring, I'm sure. But the podcast series is for more general use, and it's called The Leading Voices in Food. And I'm the positions are switched where I'm the person who does the moderating here, and we have guests. They go all the way from farmers to chefs, people working in various parts of the activists, people that are concerned about equity in the food system. It's a really interesting and broad range of people. I learned so much from doing those podcasts. I find them really interesting. So, I welcome people to check that out to see if it might interest them.
Yeah, excellent. All right. Thank you so much for joining us today for the conversation. It truly has been a delight and frankly, inspiration and motivation to keep up the good fight around these systemic and issues, especially for patients that are kind of suffering from chronic liver disease that have been, so heavily influenced by many of these aspects. Don't forget to join online and perhaps at an in-person event with one of our partners at Global Fatty Liver Day on Thursday, June 13th. For more information on that, check out our website, globalfattyliverday.com. Kelly, thank you again. It's good to see you, and we'll hope to be able to work together in the future.
Thanks, Jeff. Wonderful to connect again.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well,